Good afternoon, everybody. I'd like to welcome you to the last seminar for this current semester at the Geary Institute for Public Policy. I'm delighted to welcome Micheál from the School of Social Policy, Social Work and Social Justice. Micheál was previously Senior Economist with the Nevin Economic Research Institute. His main research interests and publications are in the areas of income distribution, taxation, redistribution, economic evaluation and public policy. Today, Micheál is going to present us work that he has recently completed on the hidden cost of poverty, estimating the public service cost of poverty in Ireland. And before Micheál presents the seminar today, I'll remind you that again, we will use the usual Q&A format of asking questions, which will then be dealt with by Micheál at the end of his seminar. So Micheál, without further ado, over to you and thank you.
Okay, thanks Darren, and thanks to Mark and colleagues at the Geary Institute. It's nice to have the opportunity to have a forum to present this work, and as Darren said, it is on, the title is The Hidden Cost of Poverty. It draws from a report that I completed earlier this year. Was published by the Society of St. Vincent de Paul. They commissioned the report to answer the question of could we estimate the public service cost of poverty in Ireland, and to go about trying to figure that out and put a number on that. Something new in an Irish context. We haven't had one before, and so it was you know, an opportunity, and I have to say, as you'll see, a challenge to get to that, but it did lead to an analysis and ultimately a report, and that's what's framing my presentation here. The report itself was linked on the abstract that was sent around by the Institute, and it appears also on the last of the slides here if you want to follow up later on. It's a long report, and it's not a straightforward answer. I'm kind of going to make my presentation in a way that reflects the structure, more or less at least, of that report, and to dive into some of the aspects of that as we go through as well. So a quick introduction, then very briefly to paint the context here, something on a profile of the population within Ireland who live below the poverty line, then into sort of firstly the challenge around placing a cost on poverty, and then beyond that actually doing it in terms of the results, or well, the analysis, and then ultimately the results and implications of that at the tail end. I frequently end up at various presentations and seminars and find that the latest thing to do is to give you the answer at the very start. So let me do that, and then I'll come around to how I got there. Ultimately, this paper, or this and report, got to a conclusion which presented three estimates for the cost of poverty: a main estimate, and then, as I'll explain later on either side of that, a low and a high estimate. So the main estimate for the annual recurring public service cost of poverty in Ireland was almost 4.5 billion euro, 4,491 million euro. And then on either side of that estimate, there was a conservative low estimate, which was just over 3 billion euro, and I suppose an extreme high, or a higher estimate, which sort of might mark the highest possible potential value for it, which was almost 7.25 billion euro. Okay, how do I get there, and where those numbers comes from, and what they might mean and imply is where I'm going to go to over the next couple of minutes. Who are we talking about to start with then? Well, the report kicks off with a profile of those who live below the poverty line in Ireland. So I've used for this report the The national poverty line set at 60% of median equivalized disposable income. In plain English translation, what that means is that it is the disposable income, so after welfare receipts come in and after income taxes are paid. And then it is equivalized or adjusted for household size and composition. And then the poverty line is estimated at 60% of the median value of equivalized disposable income. What that means for individuals or households, well, just to kind of illustrate that for a single adult, these are figures based on 2018 data. For a single adult, the poverty line was €260 a week, or in annual terms, that's about €13,500 of disposable income. For a single parent family, lone parent and a child, €350 a week's poverty line, or just over €18,000 per annum. And for a couple with 2 children, €610 a week, or €31,800 is the poverty line. And there are various other compositions of those poverty lines when you look at different types of households with different numbers of adults and children within them. If we look at those who sit below that poverty line, then, well, the report looks at it over time. If you look at it more or less over the last decade, poverty bounces around up and down a little bit, depending on various different public policies, generally that have sort of triggered transfers, and if in particular, actually, if welfare tends to grow faster than earnings, you see the numbers in poverty fall, and then vice versa. But anyway, over the last decade, that's about 700,000 people who've sat below the poverty line, and then they're concentrated in 270,000 households across the state. And of course, if you look at those, and it was one of the things I was anxious to do in terms of framing this population at the very start of the report, and something I'll touch on here, but the report does it in more detail. It is frequently the case that individuals aren't just below the poverty line, but there is some distance below the poverty line, and there is a depth of poverty analysis folded into that profile of poverty at the very start of the report, which looks at that. I'll show you one diagram on that in just a second. This report, I'll make the point a few times, but here's the first of them, is looking at the costs of poverty from the perspective of the state. So the additional expenditure that the state is incurring because of poverty, or if you want to think about that from another perspective, expenditure that would over time dissipate if poverty were no longer an issue in society. Or maybe it's more realistic to think about it would reduce if we were to see a significant reduction in poverty. Probably the elimination of poverty, which might be an ideal, is going to be very hard to achieve, but certainly significant reductions could lead to significant savings. And we got to think about, well, what are those and how might they arise? But of course, it's important to say at the outset that when we think about and talk about poverty, that really most of the costs of poverty, when you look at the various other research on this, and it's intuitive, of course, too, fall on the individuals themselves who live below the poverty line and on their households. And they aren't just clearly monetary costs, but they're also costs in terms of health and well-being and the long-term scarring effects that arise from poverty and the consequences of poverty, which follow those individuals across their own lives, and indeed can have intergenerational effects as well. But anyway, in a sense, it's important to acknowledge those. It's not what this report is doing. It's focusing on what demands fall on the exchequer as a result of the current and past experiences of poverty. And I'll come back to how I do that in a second. A brief picture then of what poverty looks like. These are those, on average, 700,000 people sitting below the poverty line. Who are they? Well, most of them, like most of the population, are adults of working age. A small proportion are those over the age of 65, and then a large number in and around well, over 200,000 a year, comes towards 220,000 a year, thereabouts, are children under the age of 17. And actually that sort of child poverty figure has inspired, at least in other countries, as I'll mention, quite a lot of the literature around looking at the costs of poverty, and triggered quite a bit of research there. I think it's in my own personal opinion anyway, it's kind of something we don't focus on particularly largely in Ireland, despite the sort of persistently high numbers that are there. And the depth of poverty, this is just the average figure. The report itself breaks it down into the various different groups within society. But just as a sort of pen picture of the depth of poverty over the period from 2008 to 2017, it's around €55 a week is on for a single adult, is how far they sit below the poverty line. Their poverty line earlier at €260 a week, so they're down around for the most part around €205 a week, so well below the poverty line. So it's not just I think that's always useful to note that, and note the depth that people are experiencing poverty, the way they're experiencing it. Okay, so that's who they are. And so the report then is about saying, well, okay, we can think about the fact that there are additional costs which arise for society on account of the fact that there is a large proportion of the population that represents about somewhere between 14 to 18% of the Irish population, and about 20% of all children, just over it in fact, who live below the poverty line. So what sort of cost does that generate for society? And that's really where this work is going. I suppose to sketch it out, when you look theoretically and at the literature, poverty is seen as imposing three costs on society: the individual costs, which I mentioned just a while ago, both in the present, and the scarring effects of that. It also places limitations on the choices that society face and have when they're allocating scarce resources. In a sense, they've got to respond to and deal with aspects of the implications currently of poverty in whatever way, and some countries do it more so than others. But clearly it takes scarce resources which aren't therefore available for other options and other activities as well. And then a third cost highlighted in the from the various sort of theoretical perspectives in the literature on this is a moral cost for societies from poverty as well, in a sense that the argument there runs that societies have some failings in terms of their ability to look after the most disadvantaged in their societies, and cost arises in that regard. I suppose of those three, I'm really looking at the second one there, and the limitations on what choices societies have because of poverty. And I suppose if we're to map it into some of the research literature there and other sort of theoretical perspectives there too, it sort of speaks to a degree to the sort of social investment literature that's there. I suppose there's a case in that literature made for a social investment and for the returns that might arise from social investment. And in a sense, this is about costing or estimating the costs that might be arising from poverty, and therefore justifying some of those investments that might arise to reduce or dissipate some of those costs. And there is too a sort of a power perspective there too, in terms of the establishment, the identification of public policy priorities, the allocation of resources, and the strength, not or otherwise, of some populations who live below the poverty line. I'm not the first to look at these issues. I am the first, I think, in Ireland to look at these issues, but there is an international literature out there which speaks to this whole issue of placing a cost on poverty. It's not particularly large literature, and I was trying to figure out a way of summarizing it in a relatively digestible way for a presentation. So this isn't a perfect way of doing it, but let me have a go anyway. There are sort of two approaches or two general approaches that have been taken in that literature to date. The first is a kind of a very macro, top-down approach to estimating a cost of poverty, so kind of taking really a society perspective and looking down, and tends to be focused on measuring losses to national income, to productivity, and to earnings. And in some cases, that literature has sort of strayed on to estimate then on the back of those losses, the losses of taxation revenue to governments as well. And then from that to generate a cost of to society of poverty. And then that tends to appear in two different ways as well. Frequently at a point in time. McLaughlin and Rank in the United States did that. Blandon and et al. In the UK did that as well. Quite an interest in this sort of area in parts of Canada as well, where a fair amount of the research literature has come out of as well. Laurie did that in 2008 for Canada. So taking that more top-down approach and at a particular point in time. And a similar approach has been adopted, but adopted by looking across lifetimes for and establishing the costs of poverty. So Holzer et al. In the United States did that. It was an interesting study focused exclusively on children and the cost that arises for states on foot of child poverty, driven by really an interest in and campaigns around child poverty in New Zealand from Pearce in 2011, was similarly taking that kind of top-down approach. And another Canadian study from Briggs et al. In 2016 doing similar as well. So that's kind of one perspective. And then there's another perspective in terms of establishing numbers here, which is a more, what I might classify as a more micro perspective or a more bottom-up perspective, which is where there is research that aggregates the particular individual costs experienced by various elements of the state. And so together then they provide a figure or an estimate for the cost of poverty. In particular, Donald Hirsch in the UK has done a lot of work around that, actually explicitly or predominantly in the area of children for that. Two reports in 2008-2013 do that for the UK. And that work was sort of extended a bit by Bramley and Watkins in 2008, and then Bramley et al. Again in 2016 to place a cost for the bottom-up established costs for the UK as well. The latter report from Bramley et al., which is kind of really interesting report and probably the nearest in terms of the literature that's out there to at least one of the main approach that I've taken in this report, does push it a little further and not only estimates public service costs of poverty, but also then tries to go and estimate broader costs associated with losses to tax and GDP because of those public service costs and some of those scarring effects, which is an interesting extension to that report. I haven't gone there because I think it's very challenging to try and establish a number like that robustly. And so answering the question just for public service costs seems a better question to interrogate and answer. So really I'm following that second approach of those. It's very much a micro bottom up. You'll see in just a few minutes across various areas of public expenditure in Ireland, determining a cost, aggregating those and getting to an overall cost for poverty. And I suppose the final thing to say then in terms of the approach here is where this study differs really from any of the other studies that I've mentioned that are out there to date on costing poverty. And that is that it establishes a range rather than a number. And for me, this kind of comes from really thinking quite a bit about the approach to this project at the outset. And I was really quite influenced by literature I would know quite well around economic evaluation and the approach that tends to be taken in economic evaluation when there is a desire to count in some way what are unquantifiable intangibles or things that are very difficult to place an accurate value on. Yet we might want to count them in some way. And if you look at the literature on cost-benefit analysis and so on, it's not infrequent for them to be approaches presented for how you might try and take into account and work in a value for something that doesn't have a particularly obvious value to incorporate. What struck me from knowing that literature and thinking about that literature is that a good way to do it, the World Bank, for example, uses quite frequently in their applications of cost-benefit analysis in various developing world contexts, particularly around sort of health and infrastructure applications there, is to establish a main estimate and then to establish a boundary, a low and high estimate on either side of that, so that you get some type of figure you can use, but you can set the parameters for the extremes around that. And that sort of influenced the approach I took to this paper then, by establishing a main estimate, and then for each of the areas of expenditure I'm looking at to determine a low estimate, which reflects really a sort of more conservative approach to costing poverty, and then a high estimate which reflects the likely upper limit, so that one can see and one can look at this and determine what I think is a reasonably plausible main estimate. But if you do disagree with that, and there's no reason why people couldn't, that they could determine that it is considerably smaller, and that moves you towards the low estimate, which in places is 0, or that moves you up to a high estimate. So it gives a range for that, and that explains what I started with in terms of 3 numbers rather than 1 number as the overall cost of poverty. To be honest, it had one other implication for me as a researcher, which is it took the project and multiplied it by 3, in that instead of coming up with 1 number, I was coming up with 3 numbers, and instead of estimating 1 figure for each of the areas I was looking at, it always required 3 estimates and 3 reasons and bases for doing that, which added to the challenge and length of doing this. But maybe that's nicer when you're at the end of it looking back than it is when you're in the middle of it trying to determine. Okay, so then the work goes on then to determine what the public service cost of poverty is, and in an Irish context then I have broken that down into expenditure in the following areas: healthcare, children and families, education and training, housing, the Gardaí, criminal justice and emergency services, and then finally some welfare support. So 6 broad areas of public policy. And I should say then, to determine the information from this, I drew on various reports from the Department of Public Expenditure and Reform. I drew on the budgetary documents for the estimates and revised estimates for 2019 and occasionally 2018 for these as well. And then a lot of the microeconomic analysis behind this was drawn from an analysis of the CSO Silk survey, which gives us profiles and compositions for the population who are in poverty or below the poverty line, and then allows us to begin to determine some associations between that population, normal levels of public expenditure, and then the excess levels of public expenditure that are arising for some of those poverty populations. Overall, there were within those 6 broad areas 25 individual, you might call them lines or programs of expenditure, and that covered a total of almost 28 billion euro of annual state spending. So it was looking at that 28 billion and then determining from that the proportion associated with poverty. I'm not going to walk through the 25 individual areas. I just thought I'd pick one to illustrate the point and the approach that's being taken to determine the estimates here. So this within the healthcare expenditure then is expenditure on primary care and community healthcare. And primary care and, let me just find my piece of paper, primary care and community healthcare then is covering things like the GP cards and the free GP cards, and the medical card overall, sorry, which is the big part of the expenditure here, various reimbursements for drug payments, long-term illness schemes, and various other dental and eye care schemes as well. And on an annual basis, the expenditure from the state there is just over 4 billion euro. So then it was a matter of determining, well, if we go into that, can we find a way of estimating the proportion that's associated with poverty? And to a great degree, in all cases, that required the identification of a proxy measure. So we could find some aspect of that expenditure which it was possible to determine the association between it and the population in society who live below the poverty line, to be able to determine what the average level of or normal level of expenditure in society was, and therefore in some way to estimate the excess expenditure associated with poverty. So for example, here it was a detailed analysis of expenditure on the medical card and the relationship between medical card possession and poverty. And that's one of the main aspects. It's between a quarter and a third of all of that primary care expenditure is on the medical card. And then if we look at the recipients of the or holders of medical cards in terms of their poverty profile, well, 75% of those who are poor possess a medical card, and they represent 36% of all medical card holders. And it's possible then to use that data to determine an average cost per card. Now that's problematic actually, because we know, and the report shows, that there's a strong correlation between poverty and poor health, and that's pretty consistent in Ireland and internationally. So if you were to use an average figure, as I have, that clearly is going to represent some type of underestimate of the expenditure that's arising for people who are in poverty. Clearly also the demand for that they would experience for health, for primary care and community health care, would not dissipate if they were no longer in poverty, because some of it isn't means tested or income driven, and actually is related to various health needs as well. And this data also only captures 75% of those who were poor, so we're missing a quarter of those who were poor who aren't factored into the calculations as well. That ultimately led to determining that basis on those average cost figures that almost 670 million of that 4 billion was associated with poverty, 16.7% of that, and that became the main estimate. But you can argue that it would be lower, that less of it would dissipate if it were the case that there was that people's incomes rose, but their health needs may persist and continue. So that gave you a lower estimate of 8.4% of annual expenditure. And then there's a higher estimate, and that was determined on the basis of some of the risk figures for ill health or for poor health behavior. In again, from the SILT data, smoking was one of the indicators I used there, and that sort of relationship with poverty, and therefore the probable arising of additional healthcare expenditure associated with that which the state would be incurring, which gave you about a quarter of that budget, just over a quarter of that budget arising from primary care and community health care. There's a long, rather miserable section of the report which on a sort of step-by-step basis walks through every single number and every single attempt to find a proxy and estimate a figure for what the proportion of that expenditure in poverty is, and also, or associated with poverty is, and then also compares that with estimates that are out there in the where they're available in the international literature as well. To a great degree, the estimates I've put forward here really look quite conservative relative to the international literature, but I can sort of trace them in some way to an evidence base and hence use them in that way. I do that for all 25 different areas, and on 3 occasions for the main, the low, and the high estimate. You get a really ugly table that looks like this. The Society of St. Vincent de Paul rather wonderfully passed my ugly table on to a graphic designer who took it and turned it into this. which is a good illustration of the power of graphic design. And so then this presents what I've just talked about there. I mentioned the 669 million euro for primary care, but it was only one of three aspects within healthcare. And then you can see it on that diagram across all of the other areas of state expenditure, where it's been possible to determine the proportion of it that is arising from poverty. So again, that brings you back to that review of that about 25 billion euro of expenditure overall. And then taken together and added together, you get that figure of 4,491 million euro. And again, the detail, or a lot more of the detail, is in the report. And to sort of bring that to some conclusion, give you the opportunity to ask any questions if you wish. Let me kind of maybe think about that number in various other ways, because I think sometimes, you know, you put those numbers out and they're not always numbers that are accessible to people, policymakers, society generally. So various ways of looking at that 4,491 million euro to finish. First, on a per capita basis, it means that the cost of the cost of the state is incurring, the additional cost of the state is incurring because of poverty, and the legacy cost of poverty runs at 900 euro, just over 900 euro per person in the state. And I suppose the argument here is that over time, if poverty were to reduce, one would expect and anticipate that those figures, that number would decrease. Clearly, it may not do so immediately, and there's an argument which the report makes that maybe one would invest to save, so that you follow that sort of social investment logic, make your investment now and ultimately reap benefits in the medium to longer term through not just better societal outcomes, clearly, but also through reduced public sector costs associated with this as well. We live in households. It's about 2,600 euro per household in the state as well. Or another way to think about it is that poverty accounts for just over 5% of all government revenue. So if we look at all of the revenue that flows in taxation and that flows in other charges to the state, well, of all of that revenue, for every 100 euro, for every 20 euro that comes in, 1 euro goes in dealing with the current and legacy costs of poverty. And then the final way I thought I'd look at this is to put it in the context of the expenditure that's incurred by various government departments. This report was completed before the arrival of the current government, which has rejigged around some of the government names, but these are the 2020 expenditure allocations for various government departments and the comparator as well. So I put the cost of poverty figure in there, and then it next to the largest government expenditure areas, and they are pre-COVID expenditure allocations too. So you can see the big spending in social protection, health and education, but then poverty in terms of the annual cost, some of which is arising clearly in all of those areas. Not a whole lot in social protection if you see it, it's mainly across a lot of the others. But that would in effect line up as the fourth largest area of expenditure, bigger than what the state does in those other areas like housing and justice and agriculture as well. And there's another graphic in the report which compares the cost of poverty to some of the large government departments and illustrates that you know, it's bigger than about 6 or 7 of the large government departments, which do have people sitting at cabinet representing them. So back to my, to finish to my table summing up those estimates as well. So the report about determining a main estimate and then on either side of that a low and a high estimate. I suppose it points to the fact that poverty is therefore imposing large costs on the state. As I said, it uses up 1 in every 20 euro of state revenue that comes in. It's paid for by everybody. I think that's important. So, you know, it is an allocation of resources that goes there, and one can question whether in the long term that's the most efficient use of resources. If we had less poverty, well, clearly we could either collect less of those resources or do something else with those resources. And that points towards that sort of social investment logic of there being a virtuous circle where we could simultaneously improve the lives of the least well-off in society while also freeing up government resources as well. It also points, as the literature tends to point, to the fact, and I suppose the estimates here help to point towards the fact that these costs on the state arise right across the areas of public policy and areas of government. So it does require, by necessity, then some type of integrated national strategy in terms of adopting this. The default think is that it's a social protection issue. Actually, social protection expenditure on poverty is reasonably small, or to put that another way, not much of it would go away if poverty were to reduce. But the bigger effects would be on the healthcare system, on the housing system, on the justice system, and the other areas that I mentioned in the estimates as well. And actually, when you look at Ireland over time, Ireland was a sort of national or international leader in terms of cross-government poverty strategies. It sort of fell out of favor in various ways. There have been attempts, but not particularly successfully over the last decade or so at doing that, and there would be some merit in pursuing that as well. The report's available online if you go and search for it. And Darren, I'm going to stop there, and thank you for your time.
Okay, thank you very much indeed, Micheál. Okay, our first question is a point of clarification, and it's coming from Kevin Denny. Is the per capita cost per non-poor or everyone?
Yeah, that's for everyone, Kevin. So in other words, it's taken for the population as a whole. One could calculate it in various ways. That's what so in terms of laying out, it was the 950 euro, then that is per person. And I suppose just a way of us trying to get a feel for how big this is relative to the population, or relative to you know, other expenditures in society.
Okay, any other questions or comments for Micheál? Okay, we have some just positive comments coming in, Micheál, for you saying this is an excellent presentation. A question here from Roma Barute, just wondering about externalities on children's future, perhaps.
Yeah, it's an interesting one. I suppose this was new territory, and so and was, in fairness, quite challenging territory to you know, explore and to try and get to a figure and a number for. Yeah, it is a kind of a point in time estimate. So of all the expenditure going on in Ireland in 2019 or 2020, it's predominantly 2019 figures. What proportion of that is associated with additional spending arising because of current past experiences of poverty? And that's where we get the answer for. But yeah, it does sketch over the fact that like, let's say one could magically switch poverty off tomorrow. There are still some legacy costs which would arise, or some scarring effects that would arise for individuals. And of course, they're quite pronounced for children, which is to a great degree why that literature I mentioned earlier tends to, a lot of it has come from looking at children and being interested in sort of highlighting that, I suppose, at one level there are enormous costs, and then at another, maybe social investment perspective, there are significant savings long term for society, and not just for the individuals themselves, but for society as a whole, from you know, strategies to reduce or near on eliminate child poverty. So absolutely big effects there, and I suppose it points towards the potential for further extensions of this over time to begin to fill in that. it becomes harder to do. There's a very good economics literature that I'd be familiar with, but it becomes harder and harder to do to then go out there and estimate the long-term costs. I suppose when we go to, in this country, really interesting surveys like the Growing Up in Ireland survey and so on, who are beginning to illustrate longitudinally what some of these experiences and ultimately costs could be. So hopefully we'll get to more insights into that over time.
Okay, thank you very much for that answer. Our next question comes from Stefan Kava. Stefan asks, what is the relative share of the cost in the different departments? Does one department stand out with high relative costs?
Yeah, so back to the tables or the charts in earlier for that. So it's broken down now. Of course, different costs, as that one of my diagrams at the end there pointed out, different departments have different levels of expenditure to start with. And I suppose, yeah, so one can think about that nominally or proportionally for different departments. The biggest area of expenditure associated with poverty is in the healthcare sector overall. So that's almost 1.2 billion. And just to sort of sketch it out, roughly there's about 900 million in housing and 900 million in justice as well, which is sitting behind at least that main estimate. Yeah, now stick with the healthcare one. The overall healthcare expenditure is, of course, enormous. So it's up at, in a normal year, we're far from that, in and around 20 billion or so. So, this is a significant proportion of that, but it's not the only thing going on in those sectors. I suppose that was one of the interesting things that struck me about these figures. And in terms of some of the further writing up of these results, I think it's one of the interesting public policy points to make, that if you took a governance perspective, poverty is a much, much bigger issue for the Department of Health, for the Department of Justice, for the Department of Housing than it is for the Department of Social Protection. The social protection system, a lot of which is derived from entitlements and rights that build up through social insurance, or including pensions and so on, or through other payments that emerge in that way, wouldn't dissipate if poverty were to, for argument's sake, disappear. So the benefits there would be, in terms of savings of expenditure, would be small, but they're much more pronounced for those other departments, and that's an interesting perspective. And it would strike me that the logic of that perspective, perhaps because we haven't had the numbers before, isn't on the radar of others. The other point that strikes me from Stefan's question is I should turn that into a nice chart or table to illustrate that point, which I will.
Okay, thank you very much. Okay, our next question is another clarification question from Kevin Denny. For the different programs, are you measuring the amount paid to the poor, or does it include the admin costs too?
Yeah, it depends on the programs, but it's principally based on the expenditure on the programs, and so that will capture. So it would be starting with the expenditure detailed or allocated per program in the Department of Public Expenditure and Reform's expenditure documents. And so then they line by line indicate what expenditure is allocated to each program, and then sometimes there's further breakdowns in that. So where it's possible to, so it depends on the program then, whether we're looking at an aggregate number which then we're working from, or whether there is some decomposition in there. But I suppose logically, for the most part, it's the total number, because we would expect some of those administrative costs to reduce were you to see poverty reducing, or indeed those administrative costs increasing were you to see poverty increasing as well. So for the most part, it's the total number.
Okay, thank you. Okay, our next question comes from Ali Bakir Hamoudi. What recommendations does the report offer in terms of how to reduce these costs of poverty? Is something like cash transfers, which take individuals above the poverty line, or what exactly is meant by social investment?
Yeah, big question, and big implications for that. I suppose the purpose of let's start with the purpose of the report first, which is really just to get to the number and to estimate what the cost is. Now, at the tail end of the report, it does kind of think about, well, what are the implications of this, or what might it imply? I suppose what it is, there's really no silver bullet here that you could sort of simply eliminate poverty in whatever way. But if we were to have interventions, whatever they may be, to focus on reducing poverty, and I would have thought a fair proportion of that might be around increases or more adequate levels of welfare targeted at particular cohorts of the population, or targeted at families with children who live below the poverty line. Go back to the composition of figure I had at the start. We have quite a large number of pensioners in Irish society, but not many of them below the poverty line, because actually our welfare pensions, for the most part, bring them up to the poverty threshold. So poverty isn't something that arises frequently for pensioners. That's changed over time, but that's been the experience for the last couple of years, mainly because welfare payments have been higher. Whereas it's more likely, if you see it for households in the working population, or the working age population as well. There have been good studies. The Vincent and Paul themselves have done good studies. The Vincentian Partnership for Social Justice, similarly very good studies looking at those experiences for households below the poverty line. So it is about realistically, at least while measuring poverty in a monetary sense is not a perfect measure, but if we look at that, and if you were to lift households up to the poverty line through additional transfers and so on, clearly there are costs to the state for that, but then alongside the cost of the state would be savings, which should over time start to generate, because there should be less costs arising, because poverty would no longer be as large a factor in society. Now, not all of it is something that could be dealt with or responded to social transfers, and there is arguments for the provision of additional public services and so on, which would do that as well. You end up in what is a very frustrating space, actually, but very realistic space in poverty analysis, where say the provision of additional public services, for argument's sake, on childcare, may not put actually any extra money in households' pockets, and may not change their status vis-a-vis the poverty line, but may actually significantly increase their quality of life, because their children are being better looked after, better educated, perhaps even better fed, but also there's greater freedom for households to pursue work or to be able to take up other opportunities. So no silver bullets for this, but the argument is there that we should make these investments with the objective of reducing poverty, and in doing so begin to shrink some of these recurring costs, which would be a saving and benefit to the state.
Okay, thank you for that very comprehensive answer. Okay, we've 3 more questions to come to, and I'll take them in the following order now. Another question from Stefan. To phrase it differently, there is a literature that highlights the cost to the justice system due to poverty. How much of the total Department of Justice budget is incurred by poverty?
Now that straight off, I don't know the answer to that, but I think it's in the report, so I could, and I don't have it just in front of me, so it's 970 million. I'll dig that out for Stefan and come back to him. Yes, it is. If we look at the expenditure of the, let me just put my papers through. If we look at the expenditure of the Department of Justice, the Department of Justice spends almost €3 billion per annum overall, and the cost of poverty associated with it, I've actually classified it as justice and emergency services. Most of that is within the Department of Justice expenditure lines, is €917 million. It's just over a third of their expenditure then is arising related to poverty. So again, back to that point, it's a big area of poverty, which I would guess isn't hugely on the radar of the Minister for Justice or the Department of Justice is actually probably a much bigger issue for the Department of Justice than it is for many other government departments as well. And I think it might be nice actually to put those numbers together in a table, which I promise I will, because it's a good way of showing and articulating that.
Okay, thank you for that answer. Okay, we have a final question from Roma Barute. Roma's question concerns is a comparative question. So she wonders, how do we compare to the EU, and also where are we relative to Nordic policies?
Well, firstly, in terms of costs of poverty, it's not, as I mentioned on the way through, it's not a very extensive literature. As I did this work and found out the misery associated with it, I maybe realized why. And I'm grateful for the patience for the Vincent de Paul who commissioned the study and understood it took a long time to get to the answer. So we don't have a whole lot of data out there to provide obvious comparators or comparators for this. As I mentioned on the way through, I took a slightly different approach then in getting the main estimate and then the low and high on either side of that. We can look at some of the UK and American estimates, Canadian estimates as well that I mentioned. One can't draw a perfect line for comparison because there are differences in approaches and estimates as well. I think I would describe what I've done here as being quite conservative in the context of the international literature. Often if you look at it on an expenditure by expenditure category, the proportions of expenditure associated with poverty that I was identifying were notably smaller than equivalent proportions that were estimated for other countries as well. Not all the time, but some of the time. And I accommodated a lot of those issues then by being able to have low and high estimates for the number. And then I suppose maybe the other comparative point to make then is Ireland sort of sits about mid-table in terms of proportions of its population in poverty. And the welfare system is very successful in reducing the level of poverty from what would be the case without transfers to what is the case post-transfers. But there are countries with notably lower levels of poverty, and there are countries that have pursued poverty strategies to reduce their levels of poverty as well. So I suppose there are comparators out there which allow us to note that that it's possible for countries to adopt strategies to reduce poverty, which clearly has big impacts for individuals, which is often the argument that's made. And I suppose this report is saying, well, on top of that, there will be benefits for the state in terms of reduced expenditure, and we can think about where they're likely to arise and the scale of what those expenditure savings are likely to be.
Okay, thank you. Our final question today comes from Ali Bakir Hamoudi. And this is probably one we want to go away and think about as well. He wanted to ask, there is a view which suggests standardized definitions of poverty, i.e. below a specific income, are not accurate enough by not taking into account the more qualitative aspects of the concept. What is your view on this definitional challenge, and how would it change the results of the report, if at all?
Yeah, I think that's a very fair point, and it is a challenge here. What I have done here, not unlike, I suppose, what the CSO does, Eurostat do, and et cetera, is we draw a line for what poverty is, and there is at least agreed definitions for what that is at 60% of median equivalized disposable income, and so you get a number, and we're looking at the proportions of the population that arise above and below that line. And of course, and it tends to be referred to as a risk of poverty, because there's no guarantee that just because you're below that line that you are unable to make ends meet. You may have very large assets, for example, to draw on. Our evidence is that there aren't too many of those, but it's possible, at least theoretically. And of course, you could be above the poverty line too, but incurring particular areas of expenditure unavoidable expenditure, for argument's sake, say healthcare needs, which mean that actually once you've incurred that expenditure, you've got very little money left over, and although you are technically out of poverty, you are having real trouble making ends meet as well. And in fairness, actually, the experience of the Society of St. Vincent de Paul on the ground is really informative on that, because they'll tell you, and their members will tell you frequently of the realities of that as well. So there's no perfect, for Ali, there's no perfect answer to that. So therefore, you know, I present these as estimates, and we are estimating the cost here. If you were to tweak and change the definition of poverty, the estimate may bounce up and down by a little bit, but it's not going to change dramatically. There are very good studies from colleagues at the ESRI and others who've done excellent work over the years through integrating in measures of deprivation alongside poverty, so that we can get a sort of richer understanding of that. And I mentioned earlier the really interesting work which I've been involved with myself over the years from the Vincentian Partnership for Social Justice, who take a different approach and do a bottom-up budget standards approach to sort of determine the cost for an individual or a household of affording the basics, and then looking at households that live below that. They get to a higher figure than the poverty line when they estimate what those costs might be. So absolutely, one could nuance away, and it is a sort of an endless issue to do that. I suppose what I would say is that even having done that, there'd be little enough argument that households who are on the incomes that I talked about at the very start here, and that's really why I put them in, so that we can see in nominal terms the amount of money that we're talking about on a weekly and an annual basis. And they are really quite small sums in terms of being able to make ends meet in society. And again, the depth of poverty analysis, briefly I mentioned, but in much more detail on the report, shows that lots of people, most people, live well below those poverty lines, and therefore clearly there are challenges, and therefore clearly that's triggering some of these costs that are arising.
Okay, thank you very much for that comprehensive answer, Micheál. Unfortunately, we're almost out of time. So all that remains for me today is to thank you, Micheál, for a really splendid seminar today. We've had a great deal of questions, and I think there's a great deal for you to go away with. And I'd additionally like to thank all of those who attended the webinar today for your participation and for stimulating questions. As I've said, this is the last seminar for this semester. I'd like to also thank Geary Institute's IT manager, Mark Hargadon, who so splendidly supported us and set everything up for such smooth working during this semester. If you check on the Geary website in the next week, details of all the seminars for the next semester will be available. So without further ado, Micheál, thank you so much indeed.
Thanks,